Good morning. I'm Rosalie Schaefer, and on behalf of the League of Women Voters of Manatee County, I welcome you to our program today. First, I'd like to thank all of the officials here today, both elected and appointed officials. I'm very pleased that all of you could make this important program. And I'd also like to thank the League of Women Voters of Sarasota County for bringing so many of their members up here to see our program. Could you all please stand so that we can see who you are? Hey. Thank you so much. We're going to talk about a very important subject for our county and our state: health care for those without insurance. Many Floridians do not have health insurance. They cannot afford to get it. They do not qualify for any of the current programs or subsidies. Their employers don't provide it, and they are falling through the cracks. At present, Florida is one of 22 states that have not accepted the $50 million in funding, which, by the way, is our own tax money that went into the federal government that's coming back out. $50 billion. And of those 22 states, 7 have the expansion currently under discussion at their legislative level, leaving Florida as one of only 15 states that are not at least having this matter on the table. But the need to get this funding is so great that businesses, hospitals, and civic organizations have all joined hands to advocate for a Florida-based program that will work for Florida and allow us to receive the funds to accomplish this. Today, our guest speakers will talk about the needs and how we can meet them and what will happen if we do nothing. We are pleased to have with us today Jill Gass, Director of We Care Manatee, which provides health services to the people in the Gap; Kevin DeLallo, CEO of Manatee Memorial Hospital, which is impacted by uncompensated care; and Leah Barber-Heinz, who's the CEO of Florida Chain, a statewide health care advocacy organization. Thank you all so much for being with us. After their presentations, we will invite questions from the audience. At that time, please use the microphone on the floor for your question and state your name. Okay, without further ado, let us start with Jill Gass.
Thank you, Rosalie, and thank you, the League of Women Voters of Manatee County, and welcome, Sarasota. My name is Jill Gass. I'm the Executive Director of We Care Manatee. I've been with We Care since 2008. During that time, we've grown the program, expanded its services, and adapted to the changes that have been happening in our community. I'm going to ask Joe to advance our slides as my remote control today. So the first slide here just talks a little bit about who We Care Manatee is and the qualifications to qualify for our program. As you can see, we cover people who are between the ages of 18 and 64 years old. We only service Manatee County residents. We are at or below 200% of the federal poverty guidelines threshold. And just to put a number to that, I've listed what that looks like. So $1,962 for a single person, or $4,042 for a family of 4. The majority of our patients are single and do not have children living in the home, so they don't qualify for a lot of traditional services, but all of our patients are medically uninsured. We started in Manatee County Medical Society, started our program in 1999, and we saw our first patients in 2001. Since then, we've treated thousands of patients for thousands of different reasons. And our annual budget is less than $380,000. Our funding comes from basically 4 different sources. About 45% comes from private grants, 25% from fundraisers, 20% from the county government, and about 10% for community or corporate donations. This is just kind of a snapshot of who our patients are by the numbers. So it looks like over the last year we had 640 patients, unduplicated patients, serviced by our specialty medical physicians that volunteer with the program, and also through our primary care clinic. The value of those services is $616,000. We also have a breast health and wellness program, and we provided 422 screening and or diagnostic mammograms to patients with a value of about $60,000. We also have a pharmaceutical program that assists those patients at $18,000. This is a breakdown of the 5 programs that we offer and about how much our patient base, kind of what percentage that would be that utilize these services. So about 45% for our specialty physician program. And all of this is done with 2 staff people, myself and 1 case manager. The case manager processes all of the patient referrals, handles all of the appointments for those patients, and kind of getting the patient through our system and utilizing the different services. We know where the ins and outs are of how to get someone assisted through our county services, and so she handles the majority of that. Everything else, it pretty much is my responsibility. So fundraising, contracting, scheduling physicians, anything administrative. So between the 2 of us, this is how we spend our time. These next couple of slides are going to be a little hard to see in the back, but it's more or less a flow chart of how we advance a patient through the system as we know it today. So this highlights some of the services. If a patient sees a specialist and they need lab services or they need an MRI, we have the steps in place and what that takes to get them through the system and how to get them eligible at the different services. So this is for our specialty physician program. The next slide will show our breast health and wellness program. So this will show how they get referred to us once they become eligible. Maybe they need a screening mammogram. If the screening mammogram turns out to be positive, and what the steps are for going forward for that. And this brings them all the way back to following up with our clinic the next year. The clinic slide shows how they get referred to us, who they may encounter during their care for clinical services, and how we always try to get them to circle back with our clinic. The next slide shows our community partners. This is a very important slide for our community to understand that WeCare would not be able to exist without its community partners. And by that, the 4 hospitals that we have available, we have Blake, Lakewood Ranch, and Manatee Memorial, and we also have a rehab hospital in Sarasota that participates with us. We have radiology centers that provide anything from x-rays, MRIs, PET scans, anything in between. We currently have 22 specialties represented with 96 individual physicians providing care to our program and to our patients. We have 2 home health agencies that participate and 4 pharmacies. It's important to note that this is the process that has developed and worked over a number of years and been critiqued and tweaked personally between all of these agencies and partners. We are working to try to eliminate patients from going to the emergency room where they would experience, a lot of them go just out of desperation. They don't know where else to go. They don't know what else to do, so they just go to the emergency room. And when they get there, they receive, a lot of them go for non-emergent reasons, so they receive care, but they are often told to follow up with a provider outside of the ER, and then they are kind of stuck in the same place that they were before they went. So it's important to note that if there's not a solution in this county provided, we will be dismantling all the hard work that we've all been doing over the last 30 years, actually, and leaving people, again, in that place of desperation where they're going to receive bills that they can't pay, and they're never receiving that services that they need. So over the last couple of years, We Care Manatee's board has developed strategic goals. This year's goals are looking to expand the primary care clinic hours, explore governmental funding options, and to grow our endowment program. How we're looking to do that is the main thing with the primary care clinic is to explain the gaps that are currently available through the Affordable Care Act and through Medicaid. A lot of folks think that Medicaid is available to anyone who is uninsured, and that's just not true. The Affordable Care Act is you're only eligible to apply if you are employed. So if you're not working, you can't apply for the Affordable Care Act. So there's still going to be that gap in our community of patients who are completely uninsured without access to purchasing health insurance if they need it. One of the things that we need to do to expand our clinic is to either hire a physician or a full-time nurse. We have medical students that are available to us to service the community, but without supervision, we don't have the volunteer physicians work full-time. So they come in on their days off, or I have one that comes in just over her lunch hour, and when she's not on call. So she comes in 5 days in a row, and then she has a week where she's on call, so she doesn't come in. But she sees 1 to 2 patients over her lunch hour for us. Then we also have physicians that, say, have Wednesday afternoons off or Friday afternoons off, and they'll come in and see patients during that time. But really to provide a more comprehensive, lasting option for us and for our community is to have a physician on staff or a nurse on staff that can handle the caseload and the patient load for us. Governmental funding options, as I said earlier during the percentage of funding that we receive from Manatee County government is about 20% of our budget. We do not pay for medical services. They're all volunteer to us. The hospital has a program that we refer to as the County Assistance Program, and patients that qualify for that program, we use the same criteria. So we know that they are often eligible for the county program, which is how we are able to provide them surgery or provide them a PET scan or provide them an MRI. But that program is scheduled to go unfunded October 1st of this year. So really those ancillary services that come from the hospitals or the radiology centers are what's most important to our program. So we are looking at other governmental options that we can provide to the community and provide the highest value of service to the community with these programs. And our last goal is to develop our endowment. The goal is to build our endowment to the point where we can sustain ourselves internally. And these are just a few of the plans that we have in place or the goals that we have over the next 12 months to do that. As a strategic partner, We Care Manatee needs exposure. We need the opportunities like this one today to reach community members so that we do have a voice in the healthcare discussion. We want to be around for perpetuity, but in order to do that, we will need the community's support and understanding of what it is that we provide and at the high value that we do provide it. So with that, I know we're doing questions at the end, so if anyone has any questions, please note them down for me, and I'd be happy to address them after the presentations. Thank you.
Now we'll hear from Mr. DeLallo, Manatee Memorial Hospital.
Thank you. Thank you, League of Women Voters, for inviting me here today. My name's Kevin DeLallo, and I'm the CEO at Manatee Memorial Hospital. Just to start off, just to give you a little background, there were 2 men starting a business. 2 men discussed how they were going to start this business. The one man said that I'm buying watermelons for $1 a piece, and his business consultant, he's discussing how this business plan is going to work. And he said, I'm going to buy watermelons for $1 a piece, and I'm going to sell them for 50 cents. And he said, sounds like a pretty good deal. And he said, how are you going to make a profit on that? He said, well, it's a volume game. If I get enough people to buy watermelons at 50 cents, then I'll make a profit. And his business consultant says, you must be a hospital administrator. It's pretty much what it's like out there. So what I wanted to do today is just go through some of what's happening with healthcare in the state and the local level. I had a nice little video, but unfortunately it comes off of YouTube, so we can't show it. But I did want to go through some of the history. So let's start with the history of where we are. In 2010, you remember that Obamacare came along. It was signed into law. One of the things that I think was very important in Obamacare when it started in 2010 was that there were three organizations, the American Hospital Association, the American Catholic Association, and the Federation of Hospitals, got together with the Obama administration, and the Obama administration wanted to make sure that they were going to have affordable care for everyone, so they wanted the hospitals to give back. So there was 2% deductions on some of our reimbursements that happened in the hospital from 2010, 11, 12, 13, and 14. Everybody took that. We figured, well, we're going to get all that money back because when 14 comes along, we're all going to enroll for Obamacare, so that money will come flowing back to the hospitals. Well, as you just heard, in 22 states, that didn't happen, and Florida happens to be one of them. So we went on with 2010. We anticipated 1 million people in Florida would be covered through Medicaid expansion. And then 2012, the Supreme Court made some rulings. The Supreme Court said that there are mandates. There are employee mandates, employer mandates, and then we made it constitutional that if you don't participate, there will be some penalties. And the penalties will hit this year. So when you file your income tax this year, you will see some penalties because if you don't have health insurance. In 2015, we expanded, we did not expand the Medicaid for the state, and we're the third largest state in the United States, and we have not taken the Medicare dollars. So here we are on June 15. We have federal funds at risk. There's about $1.3 billion for Florida hospitals to help treat the poor and the uninsured. There's $50 billion, and that's a B, 50 with a B, that's out there, that's coming to states that participate over the next 10 years. Now, I think some of the legislators, especially the House up in Tallahassee, does not want to take those dollars for the simple reason that they'll have to fund that amount of money down the road, and they feel it may bankrupt the state. But so far, other states have taken that money and have been very successful in expanding their Medicaid program. Now, without accepting funds, we get into an issue of how do we then get those funds to support the Medicaid and the unfunded that we need in our county and in our state. So let's go on to something that's called LIP fund. And you hear this a lot. LIP is called Low Income Pool. It's something that's used for Medicaid expansion, and it's money that comes back to us. So it's intended to compensate providers for services offered to uninsured and underinsured, covers shortfalls. Goal is to provide government support for safety net hospitals. Safety net hospital is Manatee Memorial. Safety net hospital is Sarasota Memorial. Hospitals that do a large percentage of Medicaid and uninsured that comes to their hospital. The state and the feds recognize that because they want safety net hospitals in their community to take care of the people who are less fortunate than we are. There's a significant funding source, Medicaid participating hospitals and non-hospital safety net hospitals. And CMS approved a one-year extension of what they call LIP until June 30th of 2015. We don't know what's going to happen on June 30th of 2015 after that LIP funding goes away. And that LIP funding can be very substantial for us to maintain what we have in our hospital. So if we don't go and if we don't really change anything, this is what happens to businesses, states, and people locally. So let's start with businesses. Businesses, actually, it's a mandate. So they get a reduction. There's an 8% hidden tax to their health insurance. There's $253 million in federal tax penalties that they would avoid. And then there's also the employee and the employer mandate. The employer mandate could be up to $2,000 to $3,000 per business if they're not participating in the program. The state leaves billions of dollars on the table. The state leaves over 20,000 jobs on the table. And the people that are in the state, if you see, we could probably insure about another 1 million people of Medicaid-eligible participants and patients if we would accept the money. 3 out of 4 would get jobs. We'd have 2 to 3 full-time jobs, and anyone earning less than $16,000 would qualify because they would have a job for the Affordable Care Act. So let's look at the impact at the local level. Manatee Memorial has been here for 61 years. We serve over 6,000 county patients. 10% of them are inpatient admissions, 90% are outpatient visits, and 60% through our emergency room, 40% are non-emergent, cancer screening, diagnostic, laboratory surgery. If you look at the cost of the uncompensated care, in 2014, we ended up at about $41 million. The state and the county subsidized us at $12.8 million. Still left a deficit of $29 million for us to fund health care at Manatee Memorial. Safety Net Hospital. People show at our emergency room all the time. And 6,000 of them were county residents, of which we took care of, and we're grateful for the county that they gave us that money to take care of those patients. So, why are we so different than other counties? Well, this is what other counties do. And I think this is very important because we've had a corpus over the last 30 years that supported us as we move forward. Other counties, and you start with DeSoto, they have an ad valorem that comes out of some general funds. Hardy, you can see they have an indigent care special district. Hillsborough, to our north, have a half-cent sales tax. Pinellas, to our north, has ad valorem. Polk County, which has a half-cent sales tax. Sarasota County, to our south, has a health taxing district. And the health taxing district generates about $50 million for Sarasota Memorial every year. And in Manatee, we have an indigent health care fund. That fund was funded by the sale of the hospital 35 years ago, or 32 years ago. And it's going to run out, and it actually has run out. So now we're looking for other mechanisms to fund it. So what's at risk? What's at risk for losing those funds is loss of coverage for 6,000 county patients, a reduction in outpatient services, the elimination of what I call the LIP pool, which is the low-income pool. If that goes away from the state, it's not only Manatee Memorial, other hospitals such as Jackson Memorial and Tampa General are at risk for hundreds of millions of dollars to their county. And county funding is really depleted because the corpus has been depleted. So what are some of the solutions? We have revenues from the Manatee County government, some general funds, their current budget about $500 million, and we look at how we drive those, requires some $22 million for all healthcare programs. We have ad valorem taxes, and we have revenues from sales tax. I think those are three things, because if you want a program in the county, and I've said this many times, the first thing we need to do is fund it. And funding it is very important, and that's what we're looking at. And that's where I am. So I'm going to let it go, and I'll come back up for questions after we're done. Thank you very much.
Now we will have Leah Barber-Hines talk about what her group is doing.
Hello, good afternoon. Thank you so much for having Florida Chain here with you today. I want to thank the League of Women Voters. You all are doing such a great job all over the state. Very strong partner with Florida Chain for many, many years. And you all have been very, very active in the Medicaid expansion fight, and you can all see how much is at stake. This is a very scary situation for Florida. I just want to make sure everybody's aware of who Florida Chain is. We are the state's leading consumer health care advocacy organization. We are a virtual organization. We're up to about 8 staff members now, but we're located all around the state. And what we do is work to ensure access to health care for everyone. So we do a lot of legislative advocacy on the state and federal level, and work on the local level too. We do a lot of empowerment work, trying to make sure that consumers are at the table and have a voice and understand what this all means. You can see that this stuff is very complicated. We've really had kind of an uphill battle in terms of communications and messaging on this campaign. There's so much noise out there. There are so many myths about the existing program. Just like the other speaker said, everybody assumes if you're low income, you must be on Medicaid. The irony is that the Medicaid program is very popular. It polls well always, and so it's interesting because it's become kind of a bad word in terms of this campaign. So Florida Chain works to break down kind of the complicated health policy issues in a way that people can understand them, and that's been challenging on this front. But We've been around for about 14 years, and we worked a lot trying to fight against the privatization of the Medicaid program. We did lose that battle as our entire program is moving into managed care, or has just moved in, but there are a lot of consumer protections in place because of a lot of hard work on behalf of a lot of groups. So I guess I just wanted to make sure that you all know what's happening in terms of trying to make sure that Medicaid expansion does happen in our state. And I do believe that there will be a time that it happens. I think it's not just a matter of when and how we can get it done. I can tell you, I've done legislative advocacy work for about 15 years in the state. And one of the things that's really struck me about this campaign is all of the groups and stakeholders that have really come to the table together. It's been really amazing, and I think it really was the intent of a lot of what went into the Affordable Care Act. It's a public-private partnership, even though people don't understand that. People say, oh, your doctor, you have an Obamacare doctor? No, it's United, and it's Florida Blue, and it's private health insurance companies that are providing the health insurance coverage. So there's a lot of confusion out there. And I want to tell you, even though this all sounds very scary, that I have never seen the groups come together the way that they have come together now on this. It's pretty amazing. So Florida Chain and all the other groups that are involved really have a lot of strategic things going on. It's all strategic. So a lot of things are done behind the scenes right now, and then there are other things that are more out in front. But the most important thing to me is that we're all talking and communicating and working together, because this is really something that benefits everyone. We know that there's a huge fiscal and economic benefit to the state, which we talk a lot about, because we know the legislature really cares about that. Florida Chain is always fighting on behalf of the consumers. But I do feel optimistic because of all the players that are at the table, and as we get further and further along, and this is year 3 that we're embarking on this campaign, the voices are getting louder and the partnerships are getting stronger. And I think the fact that Florida is #1 in the country, including California, on enrollments for our marketplace, which is the Affordable Care Act marketplace, just shows the need that we have in our state for affordable health care. I've gotten a lot of phone calls from people saying, why is Florida #1 of all places? Well, it's because we have some of the highest numbers of uninsured and some of the greatest need. So the Medicaid expansion fight really impacts our state. We have, as you've heard, almost 1 million people impacted. And because we are a tourism state, a lot of the people that we're talking about are people that are running, what drives people to Florida. It's the hotels and the restaurants. And then as a mom, I'm always thinking about people like the child care workers. So in terms of our tactics on what are we doing about this fight, one of the biggies is story collection. So all the folks that I just mentioned, we are educating them and empowering them to tell their stories. And I can tell you it's been very, very powerful. So there have been certain parts of the campaign where some of the major stakeholders, like the business folks, stepped back and said, oh, the legislature's not doing anything this year. Florida Chain and our partners, and we run what's called the Florida Health Alliance, which is a group of over 100 organizations. The league is very involved with us. We never step back. It doesn't matter to us whether the legislature is slamming the door or not. I'm hoping that we're not going to be up against that again this session, but there's already some rumblings of, nope, not this year. But one of our strategies has just been, we're not stepping back. And so what we do is continue to pull people into the campaign and put a face on the issue, because there are so many misperceptions about who is on Medicaid, who does this impact, who are the uninsured people. So as you heard from the other speakers, most of the people in this category are working. They're working people with families. So we've worked very hard to educate folks, bring them to Tallahassee, send them to different legislators' offices, teach them how to talk to the media and tell their stories. And we think that it's really been beneficial. There was a great concern that the media would become fatigued and they would stop covering this issue. And I can tell you there's been just a steady drumbeat coming from the coalition, and they have not stopped covering this issue. I get calls on a daily basis nationally and in Florida. Folks are still wanting to talk about Medicaid expansion. So I do feel encouraged that this is not a matter of if, it's a matter of when. I want to say that we're going to have to probably compromise, as I'm sure you're seeing that the other states are doing this, but they're doing it in pretty untraditional ways, and the Medicaid program is not what it once was. It's not anyway for our state because we've privatized it, and it's going through HMOs. But it's still Medicaid dollars, and it still exists to help low-income people. So there are a lot of questions out there about the Healthy Florida Works proposal and some of the other things that are floating around. And the Florida Chain reaction right now to that is that that is not a piece of legislation yet. It's a proposal. We're so pleased to see the business folks and the hospital folks and everybody coming out again very strongly on this matter. So we're encouraged, but we're not taking a position yet on some of the proposals that are floating around because there are a lot of question marks still. They're leaving it up to the legislature to fill in some of those gaps. So as of now, we don't have a hard position on some of what's floating around until we have legislation. But we do feel very encouraged that we will be able to get this done at some point, and I want to make sure everybody knows there are lots of opportunities to get involved. It doesn't have to just be telling your story. Florida Chain does a lot of communications and press work. Like I said, they're chomping at the bit. So we're always looking for people that are interested in writing a letter to the editor. Here's how this impacts my local hospital, my local community. Here's the story about my neighbor. Those little things are so powerful. So there's a lot of different ways that you can become involved in the process. So I just wanted to say we have to keep up the fight. Florida Chain's absolutely not going anywhere. And I think that we will be able to get it accomplished. It'll just be a matter of when. Thank you so much.
Thank you very much. You all have given us a great deal of information, and now we'd like to turn to the discussion portion.
Hi, I'm Betsy Benak, County Commissioner, and I'm also a member of the League. My question is, the issue about Medicaid that I've heard is that Medicaid is a failed program, that many doctors don't take Medicaid, and it doesn't work. So why would we want to expand it? That's my question.
Basically, there's two federal funded programs. Medicaid really is a federally funded program, although states kick in money for that. And then Medicare is the other one. Medicaid rates are always lower than Medicare. Medicare has become the gold standard, if you can believe that. So not from the standpoint of always the care, but really the payment. So everyone reverts back to Medicare fee schedules. Medicaid fee schedules are sometimes significantly lower, and that's why doctors don't want to participate in that program. I believe through Obamacare, through the money coming in and the states setting up some of their own programs, and through HMOs that will sponsor some of those Medicaid programs, they'll set different rates. And they'll have to get, if you're going to sell an insurance product through an HMO and it's a Medicaid HMO, you're going to have to entice doctors to be a member of that panel. And if they can't pay them to be a member of that panel, then they're not going to have a panel to sell the insurance product. So I think it's kind of a yin and a yang. If they get the funding and we sign up for it, then it's up to the Humanas and the Blue Cross Blue Shields and the Uniteds to develop a plan that will go out to find doctors and say, do you want to participate in this plan? Here are the rates. And they'll say, okay, then if you're going to guarantee me how many patients, then I'll participate in that program. So I don't think Medicaid's a failed program. It saves many, many, many lives. Many of the babies that are delivered at Manatee Memorial are Medicaid. Many of the children that are taken care of at Manatee Memorial are Medicaid, and they get great care. So I think the only reason they say it's a failed program is because of the low rates. The quality that comes out of it, that's not the issue. It's the low rates that are provided to practitioners.
You covered it really, really well. I just want to say that argument, and you can imagine that we're hearing it daily, is really based on the past Medicaid program. Like you're saying, the new structures and the new ways that they're doing this around the country, it won't even pertain. Florida Chain's actually working on a bunch of messaging right now on that, because just like he said, there will be different ways to set the rates. It'll be a completely different system. It's just still Medicaid dollars. It's an old argument. We're tossing it out.
I am Ned, and I trained partly in Canada at McGill University, and then went to Tufts University in Boston. And I got drafted in the U.S. Army. I was assigned in Japan in 68 and 69. The reason why I would like to find out is that when I came to Manatee, I've been in Manatee for 39 years. I started at Manatee, and then my partner, Dr. Whitman, told me that to apply for privilege at Blake. So I did that. So Dr. Whitman told me to go to Blake, so I practiced at Blake. I think that the 30 doctors that started Blake is one of the doctors here. So anyway, in 79, I started to organize an outpatient service here in Manatee. I had Mrs. Green, Dr. Sklerov, who was the surgeon, and I. And we organized because the bottom line is that if you have an outpatient service, like before, patients were admitted to the hospital even for simple cataract. And that drains the hospital and also payments from the government. It's too expensive to admit the patient. I used to make rounds for cataract, and the patients are discharged after surgery. So you don't have to admit patients. Now it's drive-through cataract surgery, and even maybe drive-through delivery. So anyway, my question is that there are billions of dollars going to be released by IRS to the illegals. What will happen to those billions of dollars? Do you think, as a CEO, are you going to apply also for your reimbursement from non-paying from the emergency room? In 1980, I was a member of the board of trustees at Manatee, and one of my suggestions was that I said to Ms. Glass, Pat Glass was one of the members there at that time, and I said, why don't we try to lobby to the legislature about passing a law in which the illegals, because the farmers are telling these illegals, you go to Manatee Memorial Hospital, if you have any health issues, nobody can turn you down in health care, which is true. And that drains your funds. Because they said that, I don't have to carry your health insurance. But my point is that if the government will try to pass a law in which the illegals will be made to pay like $100, for example, okay, after each payday, and then they can collect that as an escrow account, and then they can deduct that when they get admitted to the hospital. Thank you very much.
Not sure of the question, but the billions of dollars, I think you were talking about tax returns. Is that what you're talking about?
Yes, very fine.
I have no recollection of any disbursement of any of those dollars to healthcare. We have. I don't know how that's going to happen. All right. I just go back to, since I have the microphone, why not? I'll just go back to healthcare in this county is something that I believe, I've been in this county now 5 years. I was in West Palm Beach for 12 before I came here. And all counties have a solution. They all have a system. And I think healthcare in this county it has an excellent plan. The plan with the providers that we have right now in place, I think really makes things happen in this county. And now we've come to a point where in the last 30 years, we really haven't had a decision to make on how to fund it because we had the corpus, and the corpus will go away, as we know. But when you look at the organizations that we have in this community, it's spectacular. It really is. I mean, we have 3 great hospitals. We have organizations like We Care that take care of patients that can't take care of themselves. We have a one-stop clinic that can help us out. We have so many different other organizations, and we have one of the largest rural health providers in the Southeast that are in our county. And in conjunction with the health department, we have a lot of great resources. And we should really just build on those resources to take care of the patients that we have in our community. Because when you think about it, a lot of people in this community are either one job or one paycheck away from being what we call now an indigent person. And it can happen to anybody. It can happen to anyone in this room. It can happen to anyone in this community. And right now, it's the people that we rely on in this community that make this community a very special place. So drive down Manatee Avenue and you see all those small businesses, and those small businesses are impacted by, can they afford health care for their employees or can they not? And if they can't, it's a hardworking guy who can't get health insurance, who hit hard times, who has to go to a hospital, get surgery, and then go into debt because they can't afford it and they don't have health insurance. And it's a sad story. It really is. And thank God the county has funded this for 30 years, and thank God we have these resources in our community, because those people that can't afford it then get care, and they're better for it, and they appreciate it very much. So I think we're in a great situation. We just need to find out how to fund it. I don't know about the $1 billion coming from income taxes, but I know that there are $50 billion with a B sitting out there from the federal government that could be coming into the state and creating a lot of jobs and a lot of great health plans. So, thanks.
I want to congratulate everyone for doing such a wonderful job. This is so informative and so important. It's amazing to me. And I'd also like to know, what can we do? We're all sitting here on your side hearing. When we go home this afternoon, what can we do to make a difference?
I think one of the most important things with this whole campaign is information. It sounds really simplified, but people don't understand what this means. They confuse Medicaid and Medicare. They don't know how it connects to the Affordable Care Act. They don't understand what's at stake. They don't know how to make it happen. So I think education and information is number one. And that's a lot of what we're working on with even with the legislators. I mean, this stuff is very, very confusing, especially with all the changes that we've identified to the Medicaid program. So I think education and information, floridachain.org is a wonderful place to go look for ways to get involved. We have a training program. We're teaching people how to become health reform trainers and go out and talk to groups just like this one as a chain-endorsed trainer. There's an activist group. Those are the types of people that we plug into local events. We're going to have a big, we call it the Lives on the Line, where we take the different stories that we're finding and we put faces on an actual line, and the press always covers it, and they really are lives on the line. We're always looking for volunteers, people to come out. We're always looking for spokespeople that are willing to talk to the press, willing to talk to their lawmakers. There's lots of ways to get involved. You can write letters to the editor, come to Tallahassee with us. We're always looking for people to come represent the local communities up in Tallahassee. That's who they listen to. They listen to you all, the people from home. So there's a lot of different ways. I would love to talk to you more about that, but floridachain.org is a great start.
Suzanne Dickey, the League of Women Voters. The Affordable Care Act says explicitly that when a state expands Medicaid, the federal government will pay 100% of the cost of that expansion for 3 years. And after that, up to 90%. And yet the only argument I have heard against expanding Medicaid by the Speaker of last year's House here was that, well, maybe the federal government won't do it. Maybe somehow they'll back out of it. Well, they haven't backed out of Medicare. They haven't backed out of traditional Medicaid. Has anybody of our three speakers heard a different reason, a better reason for not accepting the $53 billion to help us take care of our almost 1 million people?
Well, I'll put it, I guess, as succinct as I can. There's 22 states that have not accepted it, and there are only a few of those that are Republican. Most of them are Democrat. And I really think in our own state, there's a Republican House that wants to put their heels in the sand and not move forward. because I think the Senate would pass it. So I think we have a Republican-controlled House. President Obama is a Democrat. He pushed it through with a Democratic Congress, and I think right now it's going to take time. But I think when you look at throughout the United States, most of it are Republican states that have not accepted the Obamacare. I haven't really heard a good reason, and I think that's a good question. I mean, I don't think the affordability of it later on, since we already have states that have already taken it, is probably a good argument. And the arguments that they're making from the standpoint of getting affordable health insurance, I think is a very difficult argument without taking Obamacare. The Florida plan will pump some dollars into health care for the medically indigent, but it's not going to be enough. So we're going to have to keep working with our House in the state of Florida and see if we can come up with some solutions from the House and the Senate. And then I think we can get that moving.
Thank you.
I'm Peter Mateen. I'm a physician, and I'm one of the guys in the trenches at Turning Points. And every once in a while, we run into a bottleneck as far as trying to get operating room time and things. I think probably you were aware of some of those problems, or maybe not. But I trained in Atlanta at Grady Hospital, and that was a hospital that was funded by DeKalb and Fulton County. And my question is do you see, what path do you see to getting funding for Manatee County? Obviously, the vote for sales tax was voted down, but you had 3 paths up there. You know, what path is going to be reasonable to get through? Because we really need help down there.
I couldn't answer that. I think the county commissioners have to get together and come up with a way where they can come up with how we're going to fund it. From the standpoint of sales tax was not very popular. We lost 61 to 39. But I think that would have been an excellent solution because that passes 1/3 of those costs on to tourists that come to our county and buy things. And it was a half cent. I don't think I really see a half cent when I purchase anything. It's probably negligible from the standpoint of a tax. I think there are other ways, and I think the county commissioners will get together and they'll figure it out. And hopefully we'll have a solution before the middle of this year that we can move forward and continue the program.
And just to tie on with that, I'm Karen Winden, Deputy County Administrator, and our County Commission will have a facilitated work session this Thursday morning at 9 a.m. in the County Administration Building, the 4th floor, to talk about just this topic that we're talking about. So it's very timely to have this meeting today and then tie on to the work session on Thursday. Thank you.
Yes, I'm Dr. Connard, and as was pointed out, I was one of the Dirty 30 doctors in Manatee County who created the Blake Hospital. If you were to look historically into that event, with the advent of Medicare and Medicaid in 1965, the physicians in this community became very concerned with how rapidly we could potentially go into socialized health care. The whole Blake Medical Campus is the consequence of 30 of us at that time coming together and creating our own campus for the delivery of health care. If you look at it closely, I think it represents a vertically integrated health delivery system that was put in place without federal dollars, put in place by the initiative of a lot of people coming together, and I would submit to you that it's highly successful. One of the things that probably you're not aware of is Dr. Peter Mateen has been one of the greatest leaders in healthcare that we've had in the last 12, 15 years with his work at the Galvano Center and the Turning Points. And Peter, we owe you a debt of gratitude for that. I'm very much, and I was the president of Blake from 1971 to 1979, and then we sold that facility to the present owner, Hospital Corp. I think Mr. Delala makes a very fine point, and that is that we've got all of the stakeholder talent in this community that we need in order to come up with initiatives and solutions for that. And I really applaud he and Dr. Chet Evans from LECOM who put in place the residency training program that we now have to help assure that we're going to have a fresh supply of physicians in the community. That was a great initiative, and I think it represents the opportunity that we have to come together and do more of those. I'm absolutely convinced myself, and I've been around for about 50 years in the community in healthcare, but I'm absolutely convinced that if the right venue and the right forum is pulled together, there are answers and there are initiatives that we can put into place, and we can solve the problem in a way that's going to keep the whole community out of the chaos and the confusion that's going to happen in an awful lot of places because of the Affordable Care Act. So I certainly applaud you. I am a little confused by your math, however, on the watermelons. Because if one looks closely at that, your corporation enjoyed like $452 million with an M of profit in 2013, and I need to find your watermelon patch.
The hospital's making lots of money. They've got this charge master, and they charge $50 for a Band-Aid. You know, what do you say to people who say that this is disingenuous? You know, the hospital really isn't having any problems.
Well, it's hard to be in business if you don't make money. I don't know how else you do it, especially when you open your doors and you give away services to people who can't pay you. So you want healthy hospitals. You want hospitals to make money. We pay taxes. We pay a lot of them. We pay sales tax. We pay federal income tax. We pay property tax. Manatee Memorial is on some prime property in Manatee County, and so is Lakewood Ranch, and we pay county taxes for both of them. So you want a healthy hospital. I'm not ashamed to say we do make money. I'm not ashamed to say we're a for-profit hospital, because those hospitals that are in communities like this pay back, and pay back a lot of money because we are for-profit hospitals. If you look at a not-for-profit hospital, they are tax exempt. They don't pay property tax. Nothing against Sarasota Memorial, but every time they buy a piece of property in Sarasota, it comes off the tax rolls. And then they have to go back and increase millage to pay for the indigent care coming through there. So there are two sides of the story. I think everyone wants to be connected to someone who is either a winner or is a successful business person. And I think if you heard that the hospital was failing, then you wouldn't like that story, and you wouldn't like that connected to your community. So you like to hear good stories, and I'm proud. We have a great hospital, and we make some money. So, but we have to offset that by our bad debt, and our bad debt is very significant when it comes to taking care of patients that don't have insurance.
One thing we haven't heard yet is, what is the worst case scenario if the legislature does nothing? If I could hear from all three of you on that.
The worst case scenario, I mean, we're talking to the people in the coverage gap on a daily basis. People are dying. I mean, that's the truth of it. So the facts are that this will just continue to get worse. There's a lot of high need. I don't like to think about the worst case scenario, because I do think that this will happen. Even if the legislature doesn't want to do this, we'll find other ways to do this. But people will continue to suffer, frankly. So I'm really hoping that we don't have to face that.
I don't really focus on worst case scenario either. What I have found, though, is people wait too long to ask for help or to find help. So when you have a person who's diabetic, or you have a person that has high cholesterol or high blood pressure, they wait until they have a stroke. They wait until they have a car accident because their blood sugar got too low, and then they've got all these other things going on, and maybe they've, for us, it's best if they can, what we've really tried to institute at We Care is to keep them in the system so that we make them healthy. and they may come to us sick, and maybe they need to see 5 different specialists to get better, but we make sure we try to keep track of them, and that's what the case manager role is designed to do, is to get them back in, to make sure we're going to, check your labs again in 6 months, we're going to make sure you're taking your medicine, because we follow up with them every month to make sure they're coming in to get a voucher to get those medications, and we make sure that they're following through with their services. So worst case scenario is for us is they come in and they haven't had any health care in 20 years, and then they need, the world and back. So for us, best case scenario is we keep track of them and we make sure that they stay healthy versus only treating them when they're sick.
Worst case scenario? Well, I have a lot of faith in Manatee County, and I think that we're going to find a solution. So I'm not thinking of worst case scenario at this point. I think we're going to find funding. I think we're going to solve the issue like we do. We have a lot of smart people in this county, and they'll put their heads together and we'll come up with a solution. So I'm not even looking at a worst case scenario at this point. I'm looking at how we solve the issue and how we move forward.
Okay, and I wanted to mention there are several plans in the works that have been initiated by businesses and hospitals called there's one called A Healthy Florida Works. And if you're interested in that, we have their flyers and brochures on the information table. Also on that table, we have 3 postcards, one to each of our, one for each representative, Stubbe and Boyd, and also to Senator Galvano. And we'd really appreciate it if you would take them home, fill them out, and send them in. Or if you can fill them out today, we'll mail them for you. And we thank you all for coming. We thank our speakers. They've been really wonderful. And next month, we will be having another program, and it will be on campaign finance reform, and we're going to have one of the speakers will be Rana Barzini. She is an amazing 81-year-old woman who recently walked from Sarasota to Tallahassee to emphasize the need for campaign finance reform. And we also will have a political science professor from Dr. Frank Alcock, who will talk about the history of campaign finance and what's needed to fix the problems in elections that we're having now. I want to thank the Bradenton Women's Club for the use of their hall, and I want to thank METV very much for taping this program for later viewing. So if you know anybody who missed it and wants to watch it, it should be posted on their website, metvweb.com, within a week or so. And thank you very much.